Hi, everyone. Welcome to the Budget Education and City Services Committee of CV5. Welcome, Marianne Zola and Sue Bell. Thank you so much for coming tonight. My name is Renee Kinsella. I'm the chair of this committee, and Julie Chu is the vice chair of the BEX committee. Before we begin, I'd just like to give a brief overview of how the committee works. Each presenter will have the opportunity to speak to the committee, and once the presentation is concluded, the committee will have the opportunity to ask questions, and when all the committee's questions have been answered, members of the public will be permitted to ask questions. And then once all those have been addressed, the committee goes into what's known as business session. And this is when only members of the BEX committee discuss the issue amongst themselves, determine what action to take. Everybody's view is well respected in this committee, and I would encourage every single member here to share their views. The BEX committee is somewhat different than other committees in CV5. We don't have applications, so our determinations are not as straightforward. We can decide to draft a resolution or a letter, or we can use the presentations as a first step to gather information. When the committee does have an action, the issue will be voted upon by everybody present. And then should the resolution pass, it's then presented to the full CV5 board for a vote, and that vote is the final position of the board. In this instance, the board is meeting on March 14th. We have several items this evening. The first is the discussion of the New York City Retiree Medical Plan. Second is an update on District 2 educational issues. Third is the assignment of citywide statement of need response. Just for the first item tonight, it's a presentation by Susan Dodal and Marianne Pizzatola. I'm sorry about that if I'm butchering that. Everyone on the committee has been provided with the background materials, but to sort of set the table. And you guys correct me if I'm wrong, but just prior to the proposed change provider, retired New York City employees were enrolled in traditional Medicare, and they were given a supplemental plan, which was provided by Emblem Health, known as Senior Care. And that plan is fully subsidized by the city. Healthcare costs are rising, and because of the depletion of funds, an agreement was reached between the city and the union leaders in 2018 to find some savings. And that included transitioning the retirees to a Medicare Advantage plan. That's something that's provided by private companies, contracted by the federal government. It offers lower premiums, but it could have less providers and higher out-of-pocket costs, right? So what the city wanted to do is save $600 million annually by moving the retirees to this plan. The idea started under Mayor de Blasio. The Adams administration pursued the idea despite pushback from the retirees who sued to stop it. Right now, there's a court ruling temporarily halting the switch, but there's further legal proceedings that are afoot. There is a bill that we're going to talk about tonight, 1099/2023 in the City Council. It is 18 sponsors, including Eric Botcher, which would preserve retiree healthcare choices by mandating that the city offer Medicare eligible city retirees and their Medicare eligible dependents at least one Medigap plan with benefits that are equivalent to or better than those available to city retirees and their dependents as of December 31st, 2021. And that's sort of what we're going to talk about tonight. So I think I got it right, but if not, Marianne and Sue, you just correct me and I'll turn it over to you.
Marianne, why don't you go ahead?
So, yes, thank you. My name is Marianne Pizzatola. I'm president of the New York City Organization of Public Service Retirees. I'm a retiree from New York City Fire Department Emergency Medical Service. Part of my job at that time with my union, I was also doing healthcare benefits, pensions, and things like that. So we became very, knowledgeable about healthcare plans. Also, as a 9/11 responder, we also helped pass the Zadroga Act and fight for 9/11 healthcare, which many of our retirees are 9/11 healthcare responders. We also have 9/11 survivors who are not responders, who are also suffering under the same type of an issue. We're struggling right now with the Zadroga Act, providing that 9/11 healthcare, which is why our healthcare is really important to us. So about 3 years ago, you were correct in stating that the city was looking for healthcare savings. Medicare eligible retiree supplemental plan offered by the city of New York is the least expensive plan to the city. The plan covers only 20%, the 20% of medical bills that Medicare does not cover. Medicare covers the first 80. City supplement covers the last 20. To give you an idea of what the cost of our healthcare plan is, the supplemental plan in like 1997 was about $88. a month. Today, that Medicare Part B premium, the supplemental plan went from $88 in 1997 to about $200 today. Medicare itself is a federal public health benefit, and that is our primary health care when you're Medicare eligible. That health plan is also inexpensive. It started out in 1965 with the passage of the Medicare Act. It was $3 a month. Today, that is about $174 a month. So if you want to round up all of those numbers, the Medicare eligible costs the city less than $400 a month. Unlike the active worker plans, those plans are extremely expensive in comparison. An active worker single person is about $1,000. An active worker family plan is about $2,500 a month. So what the city tried to do at the time was find savings to finance a fund that has been somewhat misused by the city and by the mayor and the municipal labor committee that pays for their premium, active worker premium, under 65 premiums. The healthcare plan by the city of New York for Medicare eligible retirees is paid for by the city because it is a low cost. There are no prior authorizations other than for things like motorized durable medical goods or cosmetic type procedures. Otherwise, if your doctor says you need a test or a procedure, you get it. Your doctor makes the medical decisions for you. There are no networks in traditional Medicare. About 99% of doctors in America accept traditional Medicare. Your city supplement pays that last 20% that Medicare doesn't pay, as long as the doctor accepts Medicare, and most of the doctors do. Unlike Medicare Advantage, which has a network, you must use their network. If you don't use their network, you are susceptible to paying other costs to see a physician. You may even have to pay for that physician up front, submit that bill back to the insurer, and hope to get reimbursed. There's also prior authorizations on just about everything. In some situations, like as in this last procurement that the city was attempting, they did temporarily suspend some of those, but they are at the will of the city and the municipal labor committee and can be reinstituted. And there's still prior authorizations on some of the most important needs of a retiree, being skilled nursing, rehab, hospitalization. We have retirees that live in continuing care residential communities. These are typically single seniors, mostly women. They either don't have children or don't have a spouse, or they plan their life with dignity that they have someone to take care of them in case there's a problem. So they go in, they sign like a lease that requires that they maintain their traditional Medicare and supplement, because there's a medical director that takes care of your health decisions. If there's an HMO or MA in place, Medicare Advantage plan in place, then you're leaving those decisions to the insurance company, which then becomes a burden to the facility where you're living. So in these situations, it's extremely critical because these people especially would be losing their access to care, or that access would be a lot more difficult to get it. That is a concern, grave concern for us. We also, when you're in a Medicare Advantage plan, you have to use their drug plan. The drug plan that was offered by the last vendor was very expensive at about $135 a month per person. If you're in traditional Medicare, typically most of us have union drug plans. If you don't have a union drug plan, you could purchase one from the city, or you could purchase one on the marketplace. Marketplace drug plans you choose based upon if they cover the drugs that you're taking. Those costs are typically $8 to $80 a month, a lot less expensive than what's being offered through the Medicare Advantage plan, and you are required to take that. You cannot purchase an outside drug plan on the marketplace if you're in a Medicare Advantage plan. These are some of the issues that we're having with these, as well as many of our retirees have advised us in the course of this 3 years worth of litigation that their doctors and hospitals would not accept these plans, and they're dropping. As a matter of fact, last night, many of our retirees got a letter from New York Presbyterian that included Presbyterian Columbia and Weill Cornell, that as of April 1st, those doctors and hospitals would not be in the Aetna network, that they were having contractual issues. Benefits when you're in a Medicare Advantage plan with those providers are based on contracts. If those contracts are not renewed, then you cannot get care from them in network. Still, those supplements, you're required to adhere to prior authorizations, but they no longer are in the network of the insurance company. For retirees that live around the country, this has become a grave injustice because we have people who are getting older, who have various forms of disability and illness. For example, those that live in Arizona or Jacksonville and want to go to Mayo Clinic can't because the Mayo Clinics do not accept Medicare Advantage plans. So this becomes a concern. In the city of New York, we have one retiree we just interviewed yesterday. She and her husband are in their late 70s, early 80s. They have an adult disabled son who's nonverbal, and he requires care from Stony Brook. Stony Brook, not in the network. We have retirees who are concerned about Hospital for Special Surgery, Memorial Sloan Kettering. Because of the issues we raised early in this fight, they went and secured a 3-year contract with both of those facilities. So while that protects you temporarily, if those contracts don't get renewed, because typically they don't sign with many Medicare Advantage companies, then your care as a New Yorker, relying upon that type of expert healthcare from Memorial Sloan Kettering or Hospital for Special Surgery would no longer be available to you. So these are some of our issues, and we think that the promises that were made to us, that we should be able to stay with the healthcare that our doctors and hospitals are in, that we don't have to worry about networks and extra costs. Most of us are on fixed incomes. I'm a DC 37 retiree. Most of us, 2/3 of DC 37 retirees make pensions under $35,000. 1/3 of them make under $12,000 a year. So it's very important that we keep our eye on what would happen to this population, that we didn't plan for this to happen. So I hope that explains some of the concerns that you had and didn't confuse you.
Thank you so much. I don't know, Sue, if you want to add anything to that, or should we go to questions or?
Why don't we hear what your questions are?
Okay, I'm going to turn to the committee. Questions from the committee. Any questions from the committee?
John does it.
Charles?
That's the.
Charles?
Oh, yes, me?
Yes,
Can you hear me?
yes, you.
Yeah,
Yes, I
sorry.
can.
Yes, there is a question, and can I also add a comment with the question, or would you rather me save that for comments?
Save your comment, just do your questions now.
Yes, indeed. I just wanted to ask about the prescription you mentioned. I might have slightly got confused. So, are you saying that you would rather have it so that the doctors, let's say you need to take medicine A, and the doctor wants you to take that medicine, you can take it instead of the insurance plan saying, no, we want you to take some alternative, we're not cool with this, and that sort of headache. Is that what you were saying? I got a little lost about the prescription part.
Sorry, in the drug part, there are actually a couple of issues. Yes, most of the drugs that are in some of these plans do have prior authorization. Right now, we don't have to worry about that. The drug plan issue is also, for example, we had a retiree who was on a very specialized drug. That drug was not in the network of the Medicare Advantage plan that they were trying to put us into. Also, if the medications that your doctor wants to give you either comes with a high co-insurance or high copay, or is not in the formulary, you don't have that ability to go out. Before, when you like today retirees are still on their traditional Medicare because the judge granted us a permanent injunction, which of course the mayor is appealing. However, if let's say my union plan or the city drug plan does not cover a drug that I need, I am free today to go onto the marketplace and find a drug plan that would cover that medication, and they're very inexpensive. In a Medicare Advantage plan, you don't have that luxury. You must use the drug plan that comes with the Medicare Advantage plan, whether or not there's a high copay, coinsurance, or the drug isn't in the formulary. So if you're forced into that drug plan, into that healthcare plan, into the Medicare Advantage plan, you must use that drug plan that comes with it if your union or does not offer a plan for you. Like, for example, I am a DC 37 retiree. I have a union drug plan. I am allowed to use that plan. Sue, for example, is not a union employee. Sue would have to purchase that plan from the plan or the city of New York. So if let's say a medication that Sue needs is not in that formulary or is very expensive, it wouldn't pay for Sue to go through that process. For her, it would have paid for her to find plan on the marketplace that would have covered the medication. But because she's forced into a privatized Medicare Advantage plan, she doesn't have that freedom. She must use that drug plan. And if the drug is not included in the formulary or comes at a high expense, she's kind of out of luck there. So it ties her hands where she doesn't have that freedom to choose what's right for her or best for her and her family. I hope that answers your question.
If I could just follow up on that, what happens? Like, is there I don't mean to be facetious, but like a police for this, or like you go outside because they don't have your formula? Do they just, they take your information, they're like, no, you can't get it? Or how do they stop you?
Okay, that's a very good question. So let's say I said, I need to take this medication and it's not in the formulary. I'm going to buy an outside drug plan. If you do that, it'll literally disenroll you from your healthcare plan. Literally, it will take you off your healthcare plan. So now you won't have a healthcare. And how I can tell you this too. We're helping the transit retirees fight this issue for themselves. They're a quasi-state agency. Some of them had waived their transit health benefits and they were on another Medicare plan or another healthcare plan on the outside, not attached to transit at all. When the MTA auto-enrolled them, because they're starting their legal fight, they're not where Sue and I are in this. When transit rolled those people into their Medicare Advantage plan by Aetna, it disenrolled them from their healthcare plans and their drug plans. So I could tell you for a fact that that's how that will work.
Yikes. Another question. Are you worried that the city, they're doing this because for cost saving purposes, right? Are you worried that they're just going to say, well, we have no funding for this at all? I don't know if that's a possibility, but under, what is it called? There's the union and the city fund that pot. If that pot becomes empty, is there a way in which they say, well, there's nothing here? I don't know if that's a possibility. I'm asking.
So that pot of money that you're referring to is called the Stabilization Fund. It was created in the 80s to pay a premium difference between the benchmark that the city has to pay up to and the GHI plan. So the benchmark is the HIP plan, the HIP HMO. That's what the law says that the city will pay up to. But they wanted to offer you two free plans. So they said the most popular plan, like 90% of retirees and 90% of employees are in GHI. So in times when the GHI plan is higher than the cost of the HIP plan, then money would have to come out to equalize that. Well, that HIP rate is $925-ish a month, or $935. So our plans, the Medicare supplemental plan, I told you was about $200 a month. It's well under the benchmark. It will never need to come out of this fund whatsoever. Medicare eligible supplemental premium cost comes out of the budget and is a line item in the budget. It doesn't come out of this stabilization fund. This stabilization fund only pays for active workers and under 65 premium difference between the HIP rate and the GHI plan, if there is one. And there's been one in the last couple of years. So that is the only purpose for that fund. So when you say, what do I worry that the fund won't be there or is not in existence to pay for this? That fund doesn't pay for a Medicare eligible's premium cost ever. They won't need to. Okay, so I shouldn't be worried because the law 12-126 of the Administrative Code says the city will pay the full cost of health coverage up to the HIP HMO for every employee, retiree, and their dependent. That HIP HMO rate today sits at about, I think, $935. Our supplemental plan only pays 20% of our health care. It's about $200 a month. It's well underneath the benchmark, doesn't come out of the stabilization fund. Yes, there is an issue with the stabilization fund. That is on the active worker under 65 plan to pay premium difference. Hypothetically, if you were to say to me, what would the premium difference be if that fund did not exist? Excluding Medicare eligibles for an active worker, you have a single plan and a family plan. The single plan would probably be about $17-20 a month, and the family plan would be about $250 if that fund was not in existence to pay the premium difference. So I think that there needs to, and there's also no oversight on that, by the way. That fund is not, there's no oversight from the controller. As long as the mayor's office and the municipal labor committee agree to use it or misuse it, that's exactly how it's used. So that was one of the things that we had said early on in this, is that that fund has been misused. It's been used to fill budget gaps, and it's been used to pay for collective bargaining raises for active workers. That is one reason why that fund is in peril today.
Understood. Okay, further questions? Any further questions from the committee? Kevin?
Mary Ann, you addressed this a little bit, but what is the status of the case in the court system? I understand that the judge has made a ruling and now it's under appeal. What's the next thing to look for legal wise?
Thank you for the question. So we do have three cases against the city of New York. The first case was filed in 2021. It's basically what is the definition, or how is defined what is the Administrative Code 12-126. We won that case in the Supreme Court. It was appealed to the First Department, and then we won there as well, and it has now been appealed to the highest court in the state, the New York State Court of Appeals. We are waiting for a court date there. The second case is the copay case. We filed that because the city tried to make it so painful for us to stay in our senior care that they were hoping we would jump to the Medicare Advantage plan. They imposed a copay on every service in our plan. There'd been no copays in that plan for almost 60 years. So we filed a case against that because it not only violated the contract, it also violated the promise. There was nothing in the contract that said that they could do that. That case, we won the injunction on the copays, and then the case, and that also is still being litigated. Actually, we filed that as a class action, and that is in the First Department Court of Appeals, the first level of appeal. Our third case is called the nuclear option, and that's where, I guess out of frustration, the mayor decided he was going to eliminate all of our choices of healthcare plans. You'd have absolutely no choice. Forced you into the Medicare Advantage plan. If you wanted to stay on traditional Medicare, you would have to waive all of your healthcare benefits, including those for your family. You would also lose your welfare funds if you left the city healthcare plan, because you'd no longer be entitled to those in some situations, not every situation. But if you did waive your city health benefits, you would also waive them for your family. We call that the nuclear option. That case currently is also sitting in that first level appeal in the First Department Court of Appeals. We do have a hearing for oral arguments on March 21st.
Thank you. Charles, do you have another question? Is your hand raised from before, or do you have an additional question?
Yes, I have additional question. Thank you. So,
Okay.
and my apologies. There's so much information. I'm trying to get my head around it. So I think please, I just wanted clarification. So what you're hoping today is for support that retirees on Medicare are not forced into this Medicare Advantage plan because of the drawbacks to it that you stated, and you kind of want more freedom to be able to be able to shop around the marketplace for like you said, different drug plans, and to be able to get the doctors that you would want, instead of being frozen out seeing a doctor because they're not in network. Am I right in understanding that, or did I get anything wrong?
You're close. I want to make sure that our retirees have the ability to stay on traditional Medicare and a supplement, that they have that choice. We always had 14 choices of plans for retirees. Active workers had 11 or 12. Every summary plan description book, this is a booklet of what your policies, your rules, the plans available to you would come out every open enrollment period, which was typically about October, November of every year. And the book usually starts with a letter from the mayor that says, "This is our book of plans that we offer you, the good workers of the city of New York. Pick the plan that's best for you and your family." Because some of your doctors are in one plan, but they might not be in another. Maybe your sister, her doctors are in Oxford. Maybe your doctors are in GHI. Maybe your brother's plan doctors might be in United Healthcare. Maybe you like the HIP plan, but choose the plan that works for you. You've always had these choices. So we want to make sure that the choice is still there for retirees and employees to be able to choose the plan that's best for them. I can't represent active workers. I could represent retirees. Promise that was made to us. We were told you would have the health care and the benefits that you had when you left employment. I left 20 years ago. When you leave the job, you're told that you would have X, Y, and Z. You know that you pay a Medicare tax from the very first paycheck you ever earned, that you would have Medicare. The city says that their healthcare benefits, their program, their supplemental plan will be my second source of healthcare to fill in the gap of Medicare. These were the promise that was made to retirees. My oldest retiree is 102. She could not go through this change of healthcare, understanding this. And even the outreach to them has been crazy because many of them are not even on social media. That's how we've been able to find them. So we want the choice. We want to be able to stay in traditional Medicare. There's no networks, there's no prior authorizations. If I need a test or a procedure, or I want to see a doctor, I can go. If my doctor says I need something, I can go. The Medicare Advantage plans is literally managed care, and they are for profit. So the only way that those companies make money is by delaying and denying you care. And this was affirmed, if you got our one pager, by the Health and Human Services Office of the Inspector General, that Aetna even has the highest delay and denial rate of 14%, as well as the network of not being able to find doctors. We have retirees that live all around the country that leave New York for whatever reason, health reasons, cost, whatever, family, and that where they are, doctors are not in the Aetna network or in any Medicare Advantage network. But yet Medicare, the federal public health benefit, is available in 99% of the places. And the few doctors that don't accept it are typically psychiatrists and pediatricians. So it's a better health benefit. We should be supporting that. And why we're also helping argue this exact issue on a national level is that we know that based upon like the New York Times expose that came out over the summer, or even the OIG and the DOJ, the congressional hearings that have been for the last year and a half on Medicare Advantage, overbilling, upcoding, taking more money out of the Medicare trust. If we keep forcing retirees without a choice into Medicare plans, a benefit that you thought that you would have from when you started paying a Medicare tax and learning about Medicare, to forcing you into privatized managed care that many of your doctors and providers don't accept, then we are also draining the Medicare trust, that one day when these young people who are on this screen aren't Medicare eligible, Medicare might not be there for them because of that. So we want to make sure that we're not only watching this at home, but we're keeping a broader knowledge about what's happening on a nationwide level, as this is the first time, because of this rule change that happened in 2003, largely unnoticed, with no open public comment period, that we believe was in violation of the Administrative Protections Act, the APA, that was put in place without any comment from Americans, that they could auto-enroll you into a Medicare Advantage plan against your will. So while that is part of a law that Sue and our team are working on trying to fix on a federal level, I've got to deal with this on the city, the state, and the federal level. Our city is a Democratic city, and we should be protecting the promises that were made to city workers that dedicated their lives to the city of New York. And I want to make sure that everyone in the city understands why we're fighting against being forced into a Medicare Advantage plan. Because this may affect us today, and you might not be a city employee, but this could potentially, on a national level, affect you and your family and your relatives and people on the other side of the country if this keeps happening in a larger scale. So
Is
Thank-
is the medical,
Thank-
sorry, is the Medicare, just one last, sorry, follow up quick. Is the Medicare Advantage plan, is that state specific to New York or, you know, a few states, or is that like a federal thing?
Very good question. I think you mean national. So they call them national plans, but their networks are not national. They actually, well, they'll say that they're national, but when we broke them down, the back of their book actually shows you that you're using an extended network, and it actually does say that there may not be doctors in your area. So while they describe it as a national plan, I don't know. I think, Sue, what'd you say? It's kind of a play on words, right?
Yeah, there are parts of the country where there really are no doctors in their network.
Yeah. We actually had a retiree in Minnesota that Aetna said, I'm really sorry. Minnesota's United Healthcare Territory. And Aetna told them, so sorry. There's no doctors in your area, but you can go to CVS and use the Minute Clinic. I'm sorry. I wouldn't tell anyone to use a Minute Clinic as healthcare. I mean, maybe in a pinch in an emergency, but that's about it.
Yikes. So what we have is the bill in the city council, the 1099/2023, which would preserve the retiree healthcare choices, because that would mandate the city to offer the Medicare eligible retirees at least one Medigap plan with benefits. So that's what we're here tonight. Like, that would be a good first step for us to support. Am I correct this evening?
So our 1099 expired, the bill expired in December of 23 when it didn't get passed. We had 18 signers on it. We're trying to get someone to reintroduce a bill, whether that bill would be a 1099 version that says the city must provide a supplement, or a bill that would basically say you cannot diminish healthcare benefits of city retirees and offer a supplemental plan. So I don't know what can come about in 2024, but on the basic premise of the issue of not diminishing a retiree's health benefit and then requiring the city to offer a supplement, that would be a great first start.
Great. More questions? Any further questions from the committee? Any comments? Any questions from any of the attendees?
Sorry, I have a
Mullet,
question.
you're here. Sorry, go ahead. I didn't see you.
Sorry, and Marianne, thank you so much for taking the time to present to us today. Would love to understand, I think it's a fantastic opportunity for a lot of residents in the city. What are some of the opposing views on the bill, and how should we think about them?
Opposing views, why they don't want to do it? I think they're afraid. They're afraid of challenges. They're afraid of challenging, I guess, people that don't want them to, you would think that this would be an easy thing to take a side of. We're talking about protecting retired workers, disabled workers, 9/11 responders, senior citizens. I mean, these are your vulnerable people. Why would you not want to do this? I don't know, Mohit, that's a really good question. Why do I not have more support on this? Good question. I know that there's been some political tug of war on this, and I'm not happy about that, because this is the lives of people we're talking about. Without calling out names or whatever, I honestly can't tell you. I wish I had an answer for that. This to me is a common sense thing. If I tell you that if you force me into this plan, that people will have health damage, their health will decline. They could potentially die. They don't have doctors. Like this lady who lives out in Suffolk County, her son must have care from this special neuro clinic who does not accept Medicare Advantage. I have a paraplegic in Arizona, no Mayo Clinic. Mayo Clinic does not accept that. Why would you take these people who have served and given their lives to the city and then say, I'm so sorry that your doctor and hospital don't take this plan. You have to drive 100 miles to go get healthcare. I don't understand that. I don't understand why I don't have support, but if you find an answer, please let me know, because I definitely want to understand this one. I think that there's confusion over the quote unquote savings. They kept saying it would save $600 million. We were able to show with the comptroller reports and the actuary reports, there was no $600 million savings anywhere. The number of the cost of our healthcare was about $439 million, which is less than 0.6% of the entire city budget. And the money was not going back to any taxpayer whatever pot of money. It was literally being put into this fund that has no oversight whatsoever, that still doesn't address a problem that's causing that fund to have financial struggle since it was created since it was created. Once that fund, they put a PICA plan, a drug plan into that fund in 2001, it started to drain very quickly. That fund has had problems in 03, 04, 05, 07, 08, 29, 2011, 2014, and today. If we keep putting in good money into a fund where there's constant problems without addressing the problem, then we're not really solving anything. We're just kicking the can down the road. But for Medicare eligibles whose premiums don't come out of that fund, this was creating confusion. There's no money. There's a hole in the budget, would OMB screaming, but that's not true. And our organization took the position we need to debunk some of this because it wasn't true. So that $600 million isn't really $600 million. It's not really a savings. It was just being given back into this fund that's been used like a rainy day fund. But I wish I knew why I didn't have the political support behind this, because for a Democratic city, mostly dealing with women and people of color who this would truly impact, mostly who were low income, mostly who were DC 37 retirees who don't make big pensions. I don't know. To me, this is a no-brainer, and I shouldn't be fighting this for 3 years and at the cost and the expense of us having to finance our own litigation. So I don't have an answer for that, but I wish I did. I'm sorry.
More
Thank-
comments? Any more questions from the committee? Charles, we have to keep going. Do you have one more question, or would you like me to comment?
Comment, is that okay?
Sure.
Yeah, so I think it'd be great if we could, if my fellow committee members, agree. I think definitely a letter of support. I just want to say I completely empathize with the issue, because I'm in a similar situation with being on Medicaid, where you're forced into going to see, you don't get the doctors you want to see. If they're not in network, it's very frustrating to get the medical care you need, and then you've got doctors that will just drop plans and change plans all the time. You've got drug plans that change their formula. One month your medicine will be covered and the next month it's not. And I think it's time that we show support and also bring up the point that this is ludicrous. We shouldn't be treating people's healthcare like this, because it's not only wrong, but it's bad for the community. We should be trying to help people to live better, to not need more healthcare services, to try to live the best they can, instead of making it so difficult and making people jump through hoops. And especially with the thing that I really can't stand is the prior authorization, which makes no sense, to constantly have to prove that you have a chronic illness, because basically, and let's just be honest, it's all down to money. The state doesn't want to pay for these medicines. One of my eye drops costs like $900. It's ridiculous, and they don't want to pay. They want you to have these cheap generic alternatives or whatever. And we really shouldn't be treating people like this. It's so wrong. And I just want to add one quick thing too. For example, I'm blind. I get an eye drop, tiny little 10 milliliter bottle of eye drop, and if I lose that eye drop, if I damage it or lose it, I have to pay out of pocket. And this is how crazy it is. They will say that little bottle should last me a month. I'm blind. I have no one to help me put eye drops in my eyes. If I miss my eye and I run out, just very quickly, please, I think it's really important. If I run out of that medication before the end of the month, I'm screwed. So excuse my French, but we need to stop treating people like this. We need to stop, doing this to people. And I'm really behind, doing definitely a letter of support.
Thank you, Charles. I
Thank-
want you to know that you do actually have this very same situation as we do. As a dual enrollee, you are also facing the same issues as we are under Medicare, Medicaid. There's actually a bill in the Senate, I believe it's Senate 7800 by Senator Gustavo Rivera, that is supposed to take away the privatization of Medicaid and increase those reimbursements to hospitals. So you might want to reach out to their office about something about that issue. But you are right. You are facing the same issue. Sue and I can tell you, we take the mantra that healthcare is a human right, not a political fight. And that's what we want to keep saying, because we believe that it is a human right. And to put people who are suffering to try to fight for themselves at a time when they're at their weakest or most vulnerable is cruel.
Thank you so much. Okay, more comments from the committee. How do we want to deal with this? Charles is in support of the resolution. What else am I hearing? Other people? Mary? Mary saying yes. Brad, Isabel, what are you thinking? Yeah? Kevin, any more comments?
What would the resolution?
The resolution would be in support. Basically what she said, that it would preserve the retiree healthcare choices and mandate the city to offer something to the retirees and their Medicare eligible dependents. At least one plan, right? That would be equivalent or better than what's being offered.
The
Right.
supplemental plan, right?
Yeah.
Need the attendance sheet back.
Any other comments? Are we generally in agreement? I need a motion if we are in agreement.
Motion to support
Motion to
this legislation?
measure to support. Okay, measure to support, what we have said about, preserving retiree health choices and mandating the city to offer these choices to the retirees. Am I getting, a sense from everybody that that's what we want to do? Okay, Brad has moved that he would support that. Do I have a second? And can we vote on this?
Second?
Okay, let me take it to a vote.
Yes. Renee,
Yes.
I mean, yes, Mohit,
Yes.
Moe?
Yes.
Mary, yes.
Yes. Yes.
Kevin.
Yes.
We have, other community boards have done, you know what I mean? We can use that language in support that we've, right?
Is Laura on?
Laura was on, has she gone?
Tristan?
Yes.
Jafar was the heart.
Zarar, are you there?
Yes, support.
Okay.
Mark,
Present but not entitled.
okay. Mike?
Mike?
Yes.
Is Joe on? Isabel?
Yes. Did you want to add something? You look,
Charles?
Yes.
Brad?
Yes. I'll tell you later. Thank you with that.
Okay, I'm sorry.
okay. That's it. Okay, so motion passes and we have a resolution in support of your efforts, and we really thank the both of you for making time. It passes Beck's committee. As I explained, this will now go to our full board, which will be presented in March. And then it's the decision of the full board. We have to wait for their vote, and that's the final, position of CB5. Whether or not they vote, I'll present our position and we'll go from there and I'll let you know. But thank you so much for being here tonight. Very, very much appreciate it. Thank you.
Yeah, thank you, Renee.
Thank you,
Very
everyone,
much.
and thanks for listening.
Thank you, thank you. Okay. So now we're going to go to our second item, which is a discussion with Superintendent McGuire. Superintendent, thank you for coming. Sorry if we went a little bit over. We also have Craig Schletzkin here, who is a member of CB5 that you all know, but he's going to wear his CEC hat tonight because he sits on the Admission and Diversity Committee. So just a few things. We wanted to check in, if we could, Superintendent, and understand what's happening with geographic preference. Our office has received a lot of letters from parents who are in favor of restoring the priority for students in District 2. It seems that District 2 is experiencing a lot of problems with the admissions, with no high school matches at all for some of their families out of their 12 school choices. The other issue that's top of mind is the literacy program choice for District 2, the Wit and Wisdom. We'd love to hear about that. And then finally, class size, which CB5 has been on record as supporting. We understand there's issues around that, or it's being implemented, so we'd love to hear a little bit more about that. So I will turn it over to you, and thank you so much for being here tonight.
Yeah, no, thanks so much for having me tonight, and be happy to talk about all of those items. I just came from an all-day meeting that we had with our elementary school principals, and that meeting was focused on the New York City Reads initiative, led by our central office, which includes also the adoption of a new kindergarten through fifth grade literacy curriculum. So I think I'll just start there. The New York City Reads initiative, just to back up for a second, does involve many academic and curricular shifts that we are asking our teachers and principals to make in our elementary schools. A part of that work is a introduction of foundational literacy programs in kindergarten through second grade. That has been alive and well and growing in our district for the past couple of years. And is really well embedded in our kindergarten through second grade, and in some schools, third grade classrooms. I just want to differentiate between those foundational literacy programs and this kindergarten through fifth grade literacy adoption, which has made the biggest splash in terms of news goes across the city. The city has approved 3 different curricula that different districts can select from. They combed through a website, an amalgamation of different research around curricula, and they identified that there were 3 curricula that were the highest quality choices, most aligned with the latest research on reading, aligned with the next generation learning standards, and also aligned with benchmarks around ensuring that the curriculum are meet and match cultural, linguistic diversity of communities. So our district selected a program entitled Wit and Wisdom. In New York City, it was District 2, District 3, District 15, District 18, and District 19 in Brooklyn were the districts that selected Wit and Wisdom. District 19 actually was an early adopter of this curriculum about 5 years ago. But the rest of us are pretty new to it. We have been learning a lot about that curriculum over the past year. We have 4 schools that, upon hearing that we were leaning heavily toward Wit and Wisdom last spring, decided this year that they would adopt Wit and Wisdom for at least a portion of their classes. Those schools are PS 340, PS 217, PS 126, and PS 225. So those schools have had teachers all year long that have been using Wit and Wisdom in their classrooms. And so today, just as like a quick little snippet, we got to hear from those principals. And in March, we're actually looking to hear from the teachers and have the teachers share their stories and work that they've been engaged in with all of our principals around Wit and Wisdom. A couple of weeks ago, we had a visit from representatives from the Chancellor's office who came to PS 340 to watch Wit and Wisdom in action. And we just got glowing remarks, not just for the work that was going on in classrooms, but the ways in which the school has really organized to make sure that the curriculum that is being taught, the ways that it's being taught, are aligned with the latest research on reading. So we're really, really excited about it. Our teachers and principals are learning more and more about Wit and Wisdom each year or each week that we have the opportunity to engage with that curriculum. And so we're planning for this spring, which is the real launch in professional learning for all of our teachers, all of our principals. That's going to continue through the summer. And then next year, next fall, will be like the full launch of Wit and Wisdom in all of our kindergarten through 5th grade classrooms across the district. So we're really excited about that one. I'll touch a little bit on, do you want me to keep going or do you want to pause?
Actually, Superintendent, can I just make a couple of comments on Wit and Wisdom, if that's okay, Renee?
Sure,
Just a
absolutely.
couple of things on that. Couple of things I wanted to point out that I think are important and helpful. District 2 chose Wit and Wisdom, but I want everyone to understand that it was not just the superintendent deciding on his own, I'm going to do Wit and Wisdom. It was a very collaborative effort. He got together a committee of some of his most senior principals, and it was a collective decision to choose Wit and Wisdom as opposed to the other two curriculums. So it was a very collaborative effort. And it was felt that for the students in our district, that was the way to go. And it has had success in other areas. PS 340, which is one of the schools that we're piloting in, is the one elementary school that actually sits in CB5. There are a lot of schools that our CB5 residents are on the border of, so they actually sit in CB6. 340, which is on the corner of 17th and 6th, that's actually my son's school, that's in there. It was rolled out to 2 grades, kindergarten and 2nd grade. As some of you may know, my son is in 2nd grade, so I know I'm actually fairly intimately involved in this, and I know pretty well. Because it's been very successful, I think the teachers are very happy with it. It's being rolled out to 1st grade next week, and within a few weeks, it's actually going to be rolled out to the other grades. So this is actually something that is happening. Parents seem to be very happy with it. Teachers, I think, really do like it. The principal of 340, who I know very well, does like it as well. But it's also been, as I said, a very collaborative effort. The teachers work very well together on this to make sure that all kids are learning and that there are metrics to see, is this working, is this not working? If things aren't working, how can we pivot to improve? So just a couple of things I wanted to add for the committee's knowledge.
Thank you so much, Craig. Really appreciate it. Does anyone, we'll stop there for a minute in case anyone has questions about that curriculum. Does anyone have questions about Wit and Wisdom?
Do we want to know what it is?
Yeah, is it more phonics based? Sure. So Mary and, people want to know, is it phonics based? What's new about it? Do you want to ask a question?
Yeah, I will.
Go ahead.
Can you give us an overview in a paragraph, just the highlights of this program and why it's so great?
Yeah, for sure. Wit and Wisdom is what they call a knowledge-based program. It is separate from the phonics program that we use in our kindergarten through 2nd grade classrooms. So we differentiate between that because during a child's school day, they have time that is specifically dedicated to phonics with this new initiative that I've been, lucky to be a part of since I've been superintendent here in the district. So all kids in the district have this separate time that is just phonics. Wit and Wisdom has a kind of like a partner organization that they work with that produces what we call decodable textbooks. So I'm sorry, decodable texts, not textbooks. They're stories, stories that are aligned with the growth that students experience in their phonics, their phonemic awareness, like their ability to decode. So we have this standalone phonics program in our schools. We have these decodable texts, these decodable stories that are aligned with the phonics. And then we have Wit and Wisdom, and kids participate in all of these programs in kindergarten through 2nd grade. By the end of 2nd grade, most kids are pretty proficient in their phonemic awareness, so they can decode most words. But a lot of that, but there are groups of kids that need continued work in decoding into 3rd and 4th grade. There also are, new words that are introduced to kids as they are getting older. But Wit and Wisdom is really a knowledge-based curriculum. So what it is built around is that there are about 4 modules that kids learn throughout the course of the year. Each module is thematic. So you might have a module on the American Revolution or seasons, or where does food come from? All of these modules are built around these like really big, I think, and I think the kids think too, interesting questions that they grapple with throughout the course of the module. They read texts that are aligned with that theme, and they write essays and stories and paragraphs that are aligned with that theme as well. And as they're going through it, they have the opportunity to, teachers introduce to them new vocabulary that is in the context of these stories and that they are reading about and writing about. And so a lot of the work we see kids participating in both full group activities. Socratic Seminar is a part of Wit and Wisdom at all grade levels. I actually watched a second grade classroom participate in this really brilliant Socratic Seminar that was about where food comes from. It was really wonderful. And then they also do some work in small groups and do some individual writing as well. So it is, I think the most important thing, like if there was like a tagline that you might use as like a takeaway, you would say that it is a knowledge-based curriculum. So it's building knowledge and building knowledge through mostly through nonfiction subjects that are aligned with social studies or science as well. So yeah, we are looking to make sure that families in the district really have the chance to see it in action. So we're planning activities next year that will allow families to come into classrooms to see it. We had one workshop on February 9th that was attended by almost 500 people. I'm sorry, 700 people, I think. There were a lot of people there. No, 500 people. And keep myself honest here. So it was just really, really well attended, and parents had great questions about the curriculum. And so we're going to continue to do a series of that. So families are familiar with what their kids are learning in school.
Thank you.
Thank
Sure.
you so much.
That was more than a paragraph. Sorry about that.
Other questions about Wit and Wisdom? Anything about Wit and Wisdom? Okay, we can go on. Thank you so much.
Sure. I don't know which order I should go in, but I'll hit class size bill, which is a complicated one, and I don't have all of the answers to this for sure, but I can tell you a little bit about what's happening both in our district and what's happening in the city. As people likely know, the class size bill was implemented over, and the intention is that it will be fully implemented over 5 years. We're about to head into, and each of the 5 years, the city of New York, well, across the city is required to implement 20% to ensure that 20% of all classrooms in New York City are meeting the new class size thresholds. And we were in good shape this year. This year was the first year of the implementation. And so looking across all of New York City, we were able to meet that first 20% threshold of ensuring that all of our classes are meeting the new class size. Next year, we will have to add an additional 20% so that 40% of all of our classrooms meet this class size threshold. And that gets a little bit more complicated. So what the city has done this year, what we've been asked to do across all of our schools, is really conduct a very, very clear audit of both classroom spaces in all of our buildings, a count of the number of kids who are in each class, to see where it is that we might be able to utilize space in order to meet this class size reduction bill. There are also a few other things that are happening that are a little less systematic. One of those things is that schools that are temporarily co-located and that co-location is coming due, those co-locations are not being renewed. So in District 2, it's not a part of CB5, but in District 2, we have one school that was co-located in the Hell's Kitchen area. And that was a temporary co-location. And so that temporary co-location is ending at the end of this year. And we have worked closely with another school to merge that school with another one where there is plenty of space in the buildings. In New York City schools, there are many places where there is space. It's just not all necessarily in the right places. And so that kind of thing, that kind of merger, co-locations changing is happening on a case-by-case basis, but it does help out with our ability to meet the class size reduction bill. We are, continuing to like explore some different options. The chancellor has a advisory group. There are people who are advocating for different things we know across the city, allowing for larger class sizes in some schools where there's maybe a certain level of proficiency, but right now none of that is finalized, and none of that is currently the policy that we're looking toward or in place as we go into the fall.
Thank you. Questions or?
Sorry, can I jump in and
Absolutely.
the superintendent did actually a really good job of framing it and describing it. I'm not a DOE employee, so I can probably say a little bit I can probably opine a little bit more. So, smaller class sizes are great. It's a great idea. Everybody wants that, and that makes a lot of sense. There's a couple of issues with it that the DOE is going to have to go through and figure out, and parents are concerned. First of all, where is this money coming from? It's going to cost a lot of money because you're going to have to build schools to meet demand. You're going to have to hire thousands of teachers. I mean, you got to find them, and then you got to hire them. And a lot of the money from the pandemic that the DOE and the state got is going to dry up, and that money already pays for very important programs, 3K and Summer Rising, which is the summer employment. In our district, there are a number of high demand schools that will be negatively affected when you think in some way from enrollment. And when we talk about the next topic, it'll tie in. But for example, Stuyvesant, which is one of the high schools in Manhattan that is a high demand high school, it's at capacity. You can't fit more kids in, but if you're going to have less classes, smaller class sizes, you're going to have to admit less kids. So you may have 20% less kids in a school that's already high demand. And there are a lot of families that are concerned about that. In Queens, which is a probably a bigger issue at the elementary school-ish level, and the superintendent may know more about that. But in Queens, there are a lot of elementary schools that are already at capacity. So if they start lowering the class sizes, where are those kids going to go? So instead of your zone school, which is 3 blocks away, you may be forced to send your kid to the next town or 2 towns over, and you have busing of young kids. So there are a lot of issues with this that the DOE is trying to figure out and trying to go through and work through. There are various proposals. People have a lot of thoughts on this on both sides. People don't want any changes to the law, and that's great. And there are good reasons for that. And there are people who are looking for amendments. So we might hear new things. The DOE is doing the best that it can. One of the things that the Chancellor David Banks said when he was interviewed by CBS was, his focus is getting the best teachers. If you have a couple more kids in the classroom, but you have a great teacher, most parents probably would want that, as opposed to a smaller class size with an inexperienced teacher who is not going to have a good experience for your child. There has to be a balance, obviously. So the DOE is working through this. There are a lot of, as the superintendent mentioned, there are a lot of parent groups. He has a panel, but there are various parent organizations that are jockeying and lobbying for this and providing suggestions. And so this is a fluid situation, as the superintendent mentioned, and we'll get through it.
Let me ask a question. Is there a teacher shortage? Is it tough to get teachers? Is that a problem?
I'm going to defer to the superintendent on that because I don't hire teachers. He would know more than that.
Yeah. There certainly is, it is certainly more challenging to hire teachers in some areas, right? Like it has consistently, ever since, for the 25 years, I don't know how long I've been in this, but for the time that I've been in education, hiring special education teachers, bilingual teachers, upper grades, math and science teachers has been a challenge. One of the things that I feel, and we are very, very fortunate to have in our district, is that when there is a teacher vacancy, that we often receive many, many teachers applying to those vacancies. Teachers who are applying from, both outside of the city and within the city when they have the opportunity to do that, with which teachers have every single year. Yeah, it is difficult for sure.
Thank you. I want to open it up for questions to the committee on the issue of class size. Questions from the committee on class size? Any, Mike?
Yeah, on class size. What about the immigrants who are in New York? Now, how are they being accommodated or not accommodated?
Yeah, so we have about 17 or 1,800 kids who are have come with families seeking asylum. That is a number that has dropped actually a little bit in the past couple of months. We have welcomed them with open arms into our schools. And it is true that when we first started enrolling new families that were coming to the city in this way, that many of our schools did not have the infrastructure that was really going to be optimal for serving and supporting students and families who really did not speak much English. Going into this school year, we are in like far better shape as a district to serve and support families. Our schools have done an incredible job of doing a few different things: hiring more bilingual teachers, hiring more bilingual staff, helping teachers who have multiple certifications or opportunities to get multiple certifications, gain multiple certifications in English as a new language. And just really learned a lot about how it is that we serve and support not just students who are not English proficient, but those who are, coming to the United States, coming to our city under, really extreme circumstances. I can't say enough about the school leaders and teachers and parents and families that have just done an incredible job of serving and supporting kids. And they have integrated them just incredibly well into our schools. But it did require hiring additional staff that had those language skills for sure.
Thank you.
And Superintendent McGuire, the superintendent is downplaying how great his team did on this. They didn't, in all the schools, there were asylum seekers in many schools. They didn't just work with them to make sure that they were integrated from an educational standpoint, from a social, from the family. There were food drives, clothing drives in each of these schools to make sure that these families were welcome and were taken care of. And the schools, it was a challenge at the beginning, but it is what it is. But his team really did pivot and really did step up and really did work together to get to make the experience as good as positive as it could be for the asylum seekers. So the superintendent should and his team should get a debt of gratitude towards them.
Thanks, Greg. Thank you. And it was really nice today during this workshop that we held with our teachers that some of our principals brought work samples from students who just a few months ago, did not speak English. And we see their written work. I mean, kids learn incredibly fast, and it was great to see that evidence of their growth.
Brilliant. Mary, you had a question?
Yeah, a couple questions. Thank you so much for a great presentation and all you're doing for the migrant kids. Is a lot of this funding factor probably outside of our district, but the fact that New York City gives free space to charter schools, and allows them to expand and does not require them to pay rent. And so, you know, some people have estimated that that's about $100 million in free space that's being given away. Could you speak to that?
Well, that's a big question. And I can touch on the edges of some of that, but I also I could do some research and come back with more answers and to questions that you might have. I do know that the number of charter schools was limited this year, that there was not much expanded growth in the city of charter school licenses or permissions as granted by the state. We are not anticipating any charter schools to begin in our district this year, and for the coming year. And I think that says a lot about the quality of schools that are in District 2. It is certainly, this is not necessarily a response to the economics of it all, but I will say that when our schools are, when there are schools that have concerns about enrollment, that the first thing that people get nervous about is will we be able to, will there be a push to place a charter school in one of our buildings? I'm very thankful to say that we do not have any buildings right now where that are being eyed for charter schools. We have plans for the 1 or 2 schools that we have a fair amount of space in. But you are correct that charter schools are they are a public school and do have access to space so long as their charter is approved by the state. And then the city does have to look to see where space might be available. But again, that's not something that we are facing, thankfully, in District 2.
Just to be clear, that New York City is the only district in the state that gives this free space to charter schools.
I can't comment on that. I don't know. If you're saying it as fact, and then I certainly can't dispute that, but I'm not exactly sure.
Yeah, I guess I'm just trying to get at the funding conundrum, because obviously a major push for the diminution of class size came from trying, the lawsuit that rebalanced the tax dollars that were not coming to New York City. So maybe we should have someone like Nora Jameson and people who are more knowledgeable in future discussions.
We've had Lenore, and we can certainly have her back again. She comes regularly to BEX and talks about this.
Yeah, I just don't want people left with the false sense that this is all being driven by, the pandemic funding going away. They're larger. This is much more far-reaching and historic in its scope.
Do you have other questions, Mary? Any other questions, Isabel? Do you have anything? No? Any other questions from the committee? Okay, we'll go on to, I guess, the next, we can talk about the geographic preference, which, as I mentioned, we received a lot of letters here in CB5. I'm sure you're receiving a lot of letters. Anyway, I'll let you speak to it.
Yes, no, and I appreciate it. And I want to first say that my role right now is that of trying to be a partner with various groups and an advocate for students and families in our district. But I will say that I'm putting this out there initially because there is one high school, that falls under the District 2 superintendency, and that's the Clinton School. And so work to either reinstate or address this challenge of District 2 being the school, a district that consistently has the lowest number of top choices for kids on the high school application. I am seeking to serve as an advocate and partner with various groups to try to address that those data and turn things around a little bit. I am partnering with working closely with our Community Education Council on this. We are aligned in our efforts to try and advocate for that from a public perspective. I am working and communicating directly with our Office of Enrollment at the central office and chancellor's team. I am working closely with with the various high school superintendents that do supervise high schools in both geographic District 2 and Manhattan in general. As people may or may not know, there was a pretty significant shift in how in geographic priority that occurred over the pandemic. And it was not a gradual shift, it was a very immediate shift. There were 5 schools that had previously had geographic priority for District 2. And in a very short period of time, those schools have gone to citywide enrollment. I think that some of the reasons why they went to citywide enrollment were led both by the school leadership within those schools, but also parent communities where children were attending. The parent communities of Eleanor Roosevelt or Eleanor Roosevelt High School, Lab High School, Museum High School, School of the Future High School, Baruch High School. These decisions were not made in isolation by the school leader, but they were made by the school communities to move from a district priority to opening the schools up to citywide enrollment. There also was, at the time, this occurred over the pandemic, there was a pause in screened admissions. So students were entering high school under different circumstances. I'm sorry, there was a pause in in testing, and so the admissions to many of these high schools did change. The criteria changed by which students gained entry to these schools. But the end result was that there were a number of schools that served almost exclusively District 2 students that expanded their enrollment zone to the entire city. And that wasn't just, for students who were high performing, but did include students with disabilities and English language learners, students who receive free and reduced lunch. And, many of the emails, if you check your inbox, probably are coming from families that are that represent a diverse group of students. So it's a pretty consistent group of families, or excuse me, a pretty broad group of families that are seeking to change these data so that students who are in District 2 have greater access to schools that are closer to home, to schools that offer the kind of programs and course diversity that families in our district have really embraced and loved. And so I can't point to something that is specific just yet about as to what it is that we are seeking to do for the coming years, but a lot of these policy changes are both made by our central enrollment team, but they're also made in part by school-based SLTs and I'm trying to work with all of them. We have a few ideas of some different things that we can do. We can look to expand some of our middle schools to 6th grade through 12th grade schools. The Clinton School, which is again the one high school that I supervise, is an incredibly popular school in our district. And families recognize that if their child gets in for middle school, then they really don't have to deal with the high school process because 8th graders have priority for those 9th grade seats. If we can increase some access, or if we can increase the number of 6th through 12th grade schools that are in our district, then that can help to serve and support schools that are currently, or excuse me, kids that are currently in our district. We really want to create, I think part of like the vision for this is helping to create a little bit more predictability around which high school a child may enter, because right now it is a very tense and challenging process for kids to go through and families to go through. And so we're trying like a multi-pronged approach to try to alleviate the challenges that are currently facing families and students.
Other questions? Other questions?
Yeah, I have some questions.
Oh,
Sorry,
okay.
can I just chime in and then before you ask questions? Just to
Sure,
chime in,
yeah,
just to
sounds
give
great,
some
yeah.
perspective from the parents. So, thank you. So, yeah, this is an issue. I mean, you got 900 emails. I also got 900 emails. I was copied on it as well. The issue is in the last 2 years. So when you apply for high school, as some of you may know, you put down 12 choices. And in the last 2 years, each of the last 2 cycles, District 2 students, I think it was 82% got one of their 12 choices, which means 18%, or almost 1 in 5, didn't get any of their 12 choices. So they got placed wherever the Department of Education wanted to put them. And a lot of the times it was just schools that were very bad fits. They could have been far. They could have just been on something on a specialty that the student wasn't interested in. But if you're not getting one, I can see you're not getting one of your top 3, but not getting any of your top 12 schools is really bad. And what happens is people just leave the system. They either go to charters or private, or they leave the city, and that's not a good thing. It's not. We don't want that to happen. So what we're trying to do, what a lot of parents want to do, is have some kind of either a district or a borough priority, or some kind of zone schools. One of the concerns one of the inequities is that we have a couple of zones. We have a couple of priority schools in our district, but not many. But Brooklyn and Queens do have it. So other boroughs have priority. So Queens students, someone who lives in Queens or goes to a Queens middle school, has priority to go to Queens schools, but they also have an equal footing to get into Manhattan schools. Whereas a Manhattan resident doesn't have any priority whatsoever. So it's almost like it's almost like an extra card that the Queens and Brooklyn residents have. That there's a huge inequity there. And it goes to with class sizes. Once they reduce class sizes, the spots in Manhattan are going to be even more of a challenge to get into. So this is a very big issue. It's not an issue that we're going to solve for this cycle, because this high school admission cycle is basically done. I think in 2 weeks the results will come out, the placements will come out for this fall. But this is a fall 2025 issue, and there are many partners, parents, parent groups, the CEC, Superintendent McGuire, Superintendent Beitelman, who's Manhattan High School superintendent. We're all working together to see what makes the most sense, and we want to do something so that our students don't have, quite frankly, hour-and-a-half commutes each way. Because if your child has a 90-minute commute to get to school, that's a failure in my mind, because that student can be doing extracurricular activities or studying, working. Many students have to work to support their families, or even just relaxing and sleeping. It's something that anybody who's had a teenager knows. Teenagers need rest, and we need to allow for that. And you have a 90-minute each way, 3-hour commute. That's a problem. So we're working very hard on this. It's something that's not going to be for this fall, but hopefully for the following fall.
Thank you so much, Craig. Isabel, we have a high school student and I'm
Yes,
delighted
indeed. Yeah.
to have Isabel ask some questions.
Yeah, I have a few questions. First of all, do you know if other community education councils have written resolutions that reference or are like specifically based around reducing commute times?
So me.
Craig wants to answer
Just in
that one.
general,
Yeah.
anyone who has an
Yeah.
answer to that question about if other community boards have commented on commute times
Sure.
or CECs.
So I know that other community boards are receiving these letters similar to
Okay.
ours. I know, Superintendent McGuire, for instance, he went to 8. I don't believe they wrote a resolution. Isabel's asking if other, community boards have written resolutions regarding the commute
Also other CECs.
or CECs. Have they written any resolutions around the commute times?
So I can, CEC1 has not, as far as I know, but CEC1 is a very small district and their kids go all over. But CEC3, I know, has taken up the issue. I don't think they have written anything at this point. I don't know about the northern Manhattan ones. I'm not really, I don't speak to 4, 5, and 6. The ones in Queens and Brooklyn, they have priority. So they have a lot of zone schools. And remember, if a zone school in Queens can be like Francis Lewis, which is the superintendent might know, but it's like 3,500 kids. A zone school by us, just because of capacity, we don't have big buildings. So a zone school by us may be 500 kids over 4 grades. So it's probably less of an issue in say Queens, where they already have borough priority or zone schools. It's more of an issue in Manhattan. It's a bigger crisis in Manhattan.
Thanks.
And just so you know, this does not include what are called consortium schools, which I know some of us know very well. That's a whole different application process. That's not part of the top 12 schools.
Yeah, of course.
Right.
I'm also curious about how D2 high school acceptance rates compare to citywide high school acceptance rates. And just as a clarification, I'm not talking about like how well the students do in terms of admissions, but I'm curious about what % of applicants schools accept. So basically, are District 2 high schools more selective than other high schools around the city?
Superintendent McGuire might be able to answer. It depends on the school. Some schools do have screening criteria, some do not. It's school by school, and I can try to find out some information on that. And I apologize, I have to leave in like another minute. My son will be getting out from across the street, so sorry.
No
I do
problem.
apologize.
So right now there are no District 2 high schools. There are high schools that are geographically located in District 2, but they aren't necessarily District 2 high schools, I guess, except for the Clinton School, which is with me. The city did move to a process of standardizing admission for screened programs other than the specialized high schools. And they created this tiered program. If you're in tier 1, your grade point average is, I don't know it right offhand, but your grade point average is here, tier 2 grade point average. And so grade point average is one of the factors that determines which high school is offered to kids. Another factor is the randomized lottery number that is assigned to kids as well. So this combination of being able to like look at what a student's lottery number is and evaluate their performance in their academic courses does lead to some level of predictability about where a child might end up in school. But I can't say that there are schools that are more selective. I can say that there are schools that are more popular, and so therefore they get more applicants per seat that is available in the school.
Okay. Superintendent, could you just describe also, because it's part of the admissions process, what diversity in admissions is, because that factors into how schools are selecting their students. It's good information for people to have.
Sure. So diversity in admissions are set asides that are established usually by a school leadership team, by an SLT, that comes together to determine whether or not they want to create a diversity set aside for a group of students, incoming students in their school. diversity most commonly is set aside for students who receive free and reduced lunch. But there are other ways that a school might include a diversity set aside. They might target a zip code, or they might target like a particular block or a series of blocks in a neighborhood. And so then the priority for a certain percentage of seats in the school is allocated to students who fit that criteria. And we have seen big changes in the diversity set-asides that some of them came alongside the change from district priority admissions to citywide admissions. And so that has created some extra strain on some families who are living in the district and seeking to attend the same school.
Thank you.
Got it. Thank you so much.
Do you have other questions?
I have comments, but those are my questions.
Okay. Other questions? Anybody have questions from the committee? Okay, we're gonna go into comments. Any comments? Isabel?
Yeah, first of all, I think far and away the most important thing here is the line in the sample received letter about raising the baseline quality of New York City schools. New York City high school admissions are extraordinarily high stakes and extraordinarily stressful. And the biggest reason that any of this is so high stakes is because we haven't committed to a strong enough baseline for public schools, and that the number, like where the public schools are, the amount of public seats don't match up that well, as we're talking about, with where kids are. So I also am really curious to like follow up on this issue of commute times. I agree with like Craig that it's a huge issue. I also don't know if it's really one that's unique to Manhattan, despite the existence of zone schools in Brooklyn and Queens. There's a 2018 NYU study that shows the Manhattan students and students in South Brooklyn are on average really have the shortest commute times by a significant amount when you compare them to kids across the city. So that's why I'm particularly curious to hear about other city education councils. Obviously that's pre-COVID. I just think it's an interesting data point. And then also that District 2 has more screen schools, just based on the data that was in that was in one of the linked resolutions from CEC2. District 2 has a lot more screen schools. Sorry, not District 2. Manhattan in particular has more screen schools than any of the other boroughs. So to some extent, the schools in Manhattan, more people are trying to get into those schools, and to some extent they are academic. I think there is a perception that a lot of the schools in Manhattan are academically stronger. So I think those are all just factors to consider when we're talking about why it's harder for District 2 kids to get in.
Interesting. Thank you.
Yeah.
Superintendent McGuire, do you want to respond or comment to that?
I mean, I think that one thing that is an important factor here is I have two kids that have gone through the New York City public school high school application system, and you know, one of them attends a more selective school. One of them attends a selective program within a borough priority school. I don't live in Manhattan, and that school is big. It's almost 4,000 kids. The only school that even approaches being that large in Manhattan or in District 2 is Stuyvesant. And we know that like that is not a school that everybody has access to, right? And so it's not a surprise, I guess, to see that there may be more screen programs in the city. I think you're right that Manhattan has a lot to offer, both students and families. We have a fairly low percentage of students who receive free and reduced lunch across our district. In New York City, the percentage is about 70%. In District 2, it's 34% of students receive free and reduced lunch. And, you know, there are a lot of things that go along with higher socioeconomic status. And so I do think that Manhattan is a place where families see high quality schools and want their kids to attend. But I agree with you 100% that the baseline is of greatest concern. I mean, and I can't begrudge any family who feels as though there is a set of statistics that match the kind of school that they want for their child. I think that it is everybody wants the best school that they can get for their child. And that encompasses like a lot of different things. You know, we know we've either read stories about it or we know people who travel 2 hours to go to a school that they want to attend. And for some families, that's fine. For some families, that's just off the table. And I completely understand that. I know it would not be it would not be something that I would want my child to do, to travel 2 hours to get to school. So, but I agree with you. What we need to do is create more really high quality programs with high graduations rates and high levels of strong levels and records of safety. I think that that's what's going to get us out of the challenge that we're facing and what's going to be good for everybody in the district and in the city. So.
And just one more comment. I'm outside now, but one more comment. One of the issues with that I know many of the Queens CECs
this is dedication. This is dedication. I just want to say.
I know that many of the Queens CECs. One of the Queens CECs is really what many of the Queens CECs are pushing for is a more specialized high schools in Queens. Yes, one we have right now Bronx Science, we have Brooklyn Tech, we have Stuyvesant, we have Staten Island Tech, we have a few more in the Bronx. But we only have one, and it doesn't have that many seats in Queens. I think it's the Queens High School for Sciences, which is a pretty small school. So what happens is a lot of Queens kids wind up traveling to the Bronx or to Manhattan if they want that type of an education. So one of the things that many of the Queens CECs are pushing for is either an expansion of the High School for Sciences or another specialized school. So that's just one more comment, but that's not obviously a Manhattan issue.
Thank you, Craig. Other comments? Other questions? I'll just go back to questions, comments. Anything else that you'd like to add, Craig or Superintendent McGuire, before please?
No, I appreciate you raising these issues. I'm very happy to come back and provide updates. Yeah, thanks for having me tonight.
Thank you so much. Really appreciate your presentation. Thank you so much for being here. Thank you, Craig, as well. Really appreciate it. Thank you.
All right. Take care.
Good night. Okay. Okay, folks, now we are going to look at the citywide statement of need for fiscal year 2025 and 2026. That was sent out to you. You're going to know. So I hope you all had a chance to take a look. It's in a document that identifies the new facilities in the city plans to site and expand existing facilities within the city. We have an opportunity to comment if we want to. There's one project in our district. Our land use committee has already unanimously approved it, but because it's come to us for the ability to comment if we want to, I wanted to put it to all of you. Do we have any questions or any comments about it?
Which one are you referring to?
I'm referring to the
Which project?
sorry, it's the space for the South Traffic Enforcement District on 30th Street. 127 West 30th Street.
The space for the,
It's for office space for Manhattan South Traffic Enforcement District
along the,
on the 127 West 30th Street. It's that expansion. We heard that last year in land use. They moved it from 11th Avenue. Their coverage area is 34th to Houston Street. It's a permanent location. I think it's page, if you're looking on there, Mary, 162 or 160. Oh, you didn't print it out.
I printed out through Manhattan, just the summaries.
Okay, so I mean, I wanted to be thorough to let everybody to have a look, but that's the only one in our district. Again, we did already comment on it through land use, but I just want to make sure if anybody else has any questions, any concerns.
Should we be upset that, or maybe it's not included in here, that the restrooms that would be located in parks don't appear in here?
The restrooms, what do you mean?
Well, if we talked about the either opening or locating restrooms in parks, so that would be a city structure. But is that not the sort of thing that would appear in here?
No,
Okay,
no.
it's just
And those
under,
have not gotten the fund, those parks have not gotten the actual funding, have they? It's the legislation requiring those and doing the survey of them, but the actual capital funding is not that one item. Holy moly.
should we be leaving the building? Should we be evacuating?
Can you imagine being a tour guide when you have this outside and it doesn't stop, but just trying to
I would
get
have
away?
first like it with a bit of color. A bit of color. So that's not, that hasn't been funded.
Okay.
Yeah.
So get upset in a couple of years after we've got.
Give it time.
Yeah, I mean, we keep putting it on the end of the.
Okay.
But I just want to make sure everybody's good with that, and we'll just go to our previous. Okay, any new business? New
Yeah.
business, Mike Quebec.
I just wanted to advise everybody that on both Saturday and Sunday, there will be free history tours. On Saturday of the Obama District and on Sunday of the Flatiron District. And if you think you know the history of both of those places, I bet you don't. So check my website or let me know and I'll give you the information, but you're welcome to join. And if you're not happy, as I said yesterday to the group, double your money back for the free tour. Double.
Nice. Okay, I just want to mention that we're thinking about task force of issues that are that are a little bit more meaty than some of the things that we can discuss here, like mental health and other issues. So if people are interested, once we get those up and together, I'll invite all of you to think about where they want to sit on a task force, whether it's migrants vis-a-vis the budget, or whether it's mental health. We're also thinking about bathrooms. So if you think about those and think, if you'd like to get involved, where you'd like to get involved, that would be really great. Because some of the issues we discuss here, I think are really a lot meatier than maybe just an hour meeting, right? And require a lot more thought. So it's worthwhile to get those together. Any other new business, Mike?
You asked me before why I was so hesitant
Yes.
to vote on the health for the retired teachers.
Yes.
It's because I read that lengthily.
Yeah.
And it's because I have that coverage that
Okay.
they don't want. And I'm dealing with some medical problems now. And I went to Sloan Kettering because people said that's the best, but it's not in my plan. I can't go there. And I had two expert doctors recommended to me who work there and they're not in my plan. And I couldn't go there.
Yeah.
But I'm at Langone. And Langone's damn good.
Yeah.
So I'm pretty happy. But the reason I voted with the rest of you was because even though I had means to seek out another great hospital like Langone, they might not in rural Illinois or someplace else.
Yeah.
So while I was hesitant, it jumped at me that, they don't have the opportunities that we do here in New York.
Yeah.
So that's why I voted.
I saw your face and I was asking you, I just want to encourage everybody, we all joined so that our voices could be heard. I hope you all feel like your opinion, whether it's like wacky likes Mike's or, no, I'm joking. But you know what I mean? That you're, you guys all bring great value, all of you. Moet, I'm sorry.
Yeah,
You
so
wanna-
just
you wanna-
a piece of new business. So I think, Renee, you covered this a little bit, but wanted to bring to the attention of the board an issue everyone already knows about, which is the migrant crisis. We've seen seeds of it throughout different issues that we've talked about in this board over the last year, and I think it's been at the forefront of local and federal policy discussions. I think it's really critical for the board to kind of dedicate time to start to understand the crisis, its implications on both individuals and our community, and to try to start problem solving pathways that we could potentially help address the crisis. I think talking about the issue helps shed light on systemic issues and humanizes those that are actually affected, and not advocating for a solution in any particular direction of any kind. I just think it's something that the board should consider talking about more holistically and understanding how we can play a role in something that is super relevant, not just in New York City, but particularly our community and our community board in Midtown.
Thank you, Mo. Yes, absolutely. And I think, again, as I mentioned, as I referred to, we're going to create a task force specifically for that. So that, and that people can join, and then once the task force comes up, then we bring it to the greater board, because, you know, some of our issues are very meaty, and it takes a lot to sort of, you know, something that like that, like you mentioned, it doesn't lend itself to an hour meeting or someone coming to talk for a half an hour. So I absolutely agree with you, and we're getting that together. Just to go back to Mike's point, I just want to say everybody is really valued here, so please, please talk. Did everybody see and get the Manhattan Borough President's State of the Thing invitation? You got that? I just want to make sure that you guys all got that, and that's it. I think that's all she wrote, unless somebody else has anything to say. I just want to say I appreciate you guys all for being here tonight, and we'll see you next week. Thank you.
At the,
Thank you.
Thank you.
Have a good night, everybody. Thank you. Thanks.
I wanted to thank you.